Hello everyone and welcome back to the third part in the series Getting Involved and Staying Engaged, the Student's Guide to Professional Membership and Social Media Participation. Previously, in the first and second portions of this presentation, we talked about the APTA and then the APTA Student Assembly. So now we'll be talking about the American Academy of Orthopedic Manual Physical Therapists, also known as AAOMPT. So how is AAOMPT structured? Very lean compared to the APTA. The executive board has 5 members: a president, vice president, treasurer, secretary, and member at large. The purpose of AAOMPT is to promote orthopedic manual physical therapy practice, education, and research. The vision statement of AAOMPT is a healthy world in motion, free of musculoskeletal pain. So it's responsible for the entry of the United States as a voting member of the International Federation of Orthopedic Manipulative Therapists, which also is known as AAOMPT. And AAOMPT is a subgroup of the World Confederation for Physical Therapy. So AAOMPT sets standards for orthopedic manual physical therapy fellowship programs within the United States, and they also promote residency and fellowship education in general for PTs in the United States. Fellows of the Academy are known as AAOMPTs. AAOMPT also publishes a quarterly journal, the Journal of Manual and Manipulative Therapy, which is given to student members for a student membership, which is only $15 a year, or you can pay an additional fee to get the journal in print copy. AAOMPT also operates a practice affairs fund similar to the PT PAC, which funds advocacy efforts both to APTA state chapters and the Foundation for Physical Therapy. Within AAOMPT is the AAOMPT Student Special Interest Group, or sSIG. So very similar to the executive board, the Student SIG has a president, yours truly, a vice president. This year we have 2 members at large. We have a web admin, so Melissa runs the AAOMPT blog on behalf of AAOMPT, and then we also have a conference chair who is going to be planning events and student-geared content at the 2017 AAOMPT conference in Salt Lake City. The Student SIG purpose is to serve the student members by fostering active student involvement and networking with AAOMPT, to develop a community of students committed to the advancement of orthopedic manual physical therapy, and to promote education of orthopedic manual physical therapy at the university level through the AAOMPT Student Local Program. The functions are to provide leadership and networking opportunities for student members, to operate the AAOMPT blog, as I said previously, to maintain an AAOMPT Student SIG discount with MedBridge. So right now, Student SIG members can get a MedBridge membership for $100 a year. Also, at the annual AAOMPT conference, the Student SIG runs a silent auction and 50-50 raffle, and that money goes to provide travel scholarships for students to the AAOMPT conference. So last year, at the 2016 conference in St. Louis, we were able to provide $2,400 to students for travel scholarships to help them attend the conference. And our goal this year is to bring in much more than that and bring a lot more students to the AAOMPT conference. Talking a little bit about the AAOMPT Student Local Program, you can think of it as a university level manual therapy club. The goal is to increase awareness and implementation of manual therapy principles within an active learning environment, with the goal being independent clinical decision-making with orthopedic manual physical therapy. So these ASL groups are recognized by AAOMPT. They meet twice a semester with a big focus on hands-on manual therapy practice and orthopedic clinical reasoning, whether that be diving deeper into material already discussed in class or bringing in guest speakers to talk about things that aren't talked about or aren't talked about heavily in class. Some of the topics we've had at the University of Michigan Flint with our ASL are diagnosis and treatment of runners, of swimmers. We had a session on how to evaluate shape and fit orthotics for patients, especially active patients. We had a joint session between our ASL and our neurological special interest group, talking about the orthopedic manual physical therapy diagnosis, evaluation, treatment of concussion alongside the neurological component as well. And so these groups are mentored by an AAOMPT fellow, either within the university faculty, if the university has one, or from a nearby fellow who is willing to come and mentor that group. You can check out more about the ASL program at this website. In addition, you can use a tool on the website to find an AAOMPT fellow to be your mentor if you don't have one at your university, and in general to find out more about the program and how to apply. So in this third part of our presentation on involvement and engagement for physical therapy students, we talked about the American Academy of Orthopedic Manual Physical Therapists, or AAOMPT, as well as the AAOMPT Student SIG. The next part, the fourth part of this presentation, will talk about social media use and engagement for physical therapy students. So thank you for watching, and I look forward to seeing you again soon.